The number of deaths from the new coronavirus in Italy and France continues to rise quite dramatically. Italy's health ministry calling on people to stay strong, saying that the confinement measures would start to show results. We'll be getting the very latest from Seema Gupta in Rome. The UK starts to follow other nations and bring in restrictions, with the schools set to close by the end of the week. People there are being asked to isolate themselves as much as possible. Meanwhile, in Germany, Angela Merkel says this is the biggest test of collective solidarity since the Second World War. She makes an extremely rare televised address in a bid to get Germans to heed the call to stay at home. Hello and a very warm welcome to you. I'm Eve Irvine. Glad you could join us. Do not give up. That was the call from the head of Italy's National Health Institute as he told people that it would take a few more days to see the benefits of containment measures. Italy has now recorded more than 1/3 of the global deaths from this new coronavirus. On Wednesday, 475 people there died from COVID-19. The country has shut down all businesses and public gatherings. Authorities say these measures must remain to protect the most vulnerable.
48.5% of the deceased had 3 or more pathologies. Often these are people over 70 years old. We've already said that the peak is between 80 and 89 years old. These are people who are living in a situation that we technically call a situation of fragility.
Well, we can cross now to our correspondent in Rome, Seema Gupta. Seema, we're seeing a dramatic rise in the number of deaths, first of all, in Italy. A call, though, for people to stay with the confinement measures. What's the latest on the reality overall of the situation there, the extent to which people are getting sick and how people are indeed coping with the measures?
Well, as you mentioned, these are immense numbers, 475 dead with the coronavirus infection. And as we heard, Italy is nowhere near its peak. We can expect these numbers to continue to rise or stick with these massive deaths, unfortunately. The president of Lombardy region, and that's where really most of the infections and most of the deaths are, has said very clearly, he's warned that soon they may not even be able to treat any of the sick in that region. And they're really stressing on this point to stay at home. You may not have the symptoms, but you may indeed be spreading them. The sports minister has even threatened cancelling or evaluating the idea of stopping the permission to go out and take a jog, because the feeling is people are not taking this seriously enough. There's also a suggestion that schools may close beyond that 3rd April deadline that was initially set. For most people, staying at home, being cooped up, working from home, as well as having the children at home, they're getting their lessons online, relying very heavily on technology. But the strain is starting to show. It is frustrating, and which is why there are all these solidarity measures to try and boost people's spirits, to understand that the actions they take are necessary in order to save lives. That said, though, the authorities have recorded 43,000 violations of the lockdown measure in the space of 1 week as people try to navigate the situation and understand what they can and cannot do. But the authorities keep stressing, stay at home.
Indeed, the clear message, stay at home, you could save lives. And indeed, hospitals in Italy have been at the brink for days now. As you were saying, soon may not be able to take any patients. I've been reading that young doctors being brought in a bid to help support the healthcare workers who are currently on the front line. What more can you tell us on that?
Well, yes, they've fast-tracked some of the graduation of these doctors that are about to graduate and become full-fledged medical professionals. They've also called in military doctors or called in the retired doctors to come back into service if you can. On Wednesday, we also saw 300 intensive care doctors arrive from China, sharing their expertise and their know-how with the local doctors. Of course, one has to remember the doctors, the healthcare professionals, they're at the front line of this war against this virus. And we've seen, unfortunately, more than 2,600 medical professionals infected themselves. And that means they can no longer go to work and carry out the important work that they're doing. We've also seen the authorities in Lombardy moving intensive care patients for other purposes out of the region. We've seen them set up temporary hospitals in the Fiera di Milano, the exhibition space in Milan. It's being converted into a hospital. The same thing is happening in different parts of Italy. Here in Rome, 3 new hospitals have been set up to deal with any potential increase in the number of infections here. And they're also calling on factories here in Italy to produce those much needed masks as well as respiratory equipment, on top of asking for donations, of course, to acquire more of this equipment. All of this very essential for the doctors who are trying very hard to treat the number of patients that are coming in with COVID-19.
Okay, Seema, for now, thanks very much indeed for that update. Seema Gupta there, coming to us from Rome. Well, meanwhile, here in France, the number of deaths also on the rise. The French military also being used. They're being currently using to help evacuate patients with COVID-19 from the overwhelmed hospitals in the east of the country. The main cluster of French cases currently, a field hospital also being set up. Alexander Ocott has the details.
French President Emmanuel Macron has already declared war on the coronavirus, and now the army has been deployed on home soil to help overwhelmed hospitals. The first 6 patients of all ages were transported by this medical plane. It is normally used to evacuate wounded soldiers from war zones that are in need of intensive care. Never before has it been used in France for civilian patients. The evacuees are being taken to military hospitals in the south after those in the city of Mulhouse in the east of France became overwhelmed. It has been on the front line of the nation's coronavirus outbreak for the past 2 weeks. Respirators, masks and even medical staff are all in short supply. The 52 intensive care beds are all taken. Nationwide, more than a third of over 9,000 confirmed cases are in hospital. 931 require intensive care, and officials say they're not all from high-risk groups.
Half of the patients that are in intensive care are less than 60 years old. Unfortunately, 264 people have died so far. 7% of those deaths occurred among patients under the age of 65.
Back in Mulhouse, the army is also due to set up a field hospital, probably in the car park of the emergency ward. This will add an extra 30 desperately needed emergency beds and dozens of military doctors and nurses. It will still be days before the unprecedented peacetime operation is fully up and running, however, and there's no guarantee it will be enough to cope with the rapid surge of COVID-19 cases in the region.
Meanwhile, Asian hotspots, China and South Korea, have seen new infections and deaths level out in recent weeks. This Thursday, China reported no new domestic cases for the first time since it started recording them in January. No new cases in Wuhan, that city where it all began. National media says that if that continues for a consecutive 14 days, lockdown measures there will gradually be lifted. So good news on that front. However, China did confirm 34 new cases that came in from abroad. So it's not fully clear of the virus as yet, but China is already sending help to Europe, medical resources, including millions of masks, and as Seema Gupta was telling us a little bit earlier, also hundreds of doctors. Well, the UK has now announced that it too will start closing its schools in the coming days and putting 20,000 troops on standby in efforts to deal with the spread of the new virus there. Over 100 people have died from COVID-19 in the UK. Boris Johnson had held off on following actions taken by other countries because of the impact on the economy.
We therefore need schools to make provision for the children of these key workers who would otherwise be forced to stay home. And they will also need to look after the most vulnerable children. This will mean that there will, of course, be far fewer children in the schools, and that will help us to slow the spread of the disease. And these measures are crucial to make sure that the, as I said, the critical parts of the economy keep functioning and public services keep functioning.
In Germany, Chancellor Angela Merkel has called for solidarity, telling people this is the biggest test of that since the Second World War. The country is not officially in lockdown, but people have been asked to stay inside to implement social distancing. A call so far, however, that's falling on many deaf ears. Aside from an annual New Year's message, this is the first direct address that Angela Merkel has made in her 14 years in office.
Germany's longtime leader has steered the country during hugely turbulent times, from the 2008 financial crash to the 2015 migrant crisis. But this is the first time she's felt the need to make a national appeal on the airwaves. In what's being dubbed a final warning to avoid a national lockdown, Chancellor Angela Merkel pleaded with the population to limit their contact to protect the vulnerable.
Es ist ernst. Nehmen Sie es auch ernst. Seit der deutschen Einheit, nein, seit dem Zweiten Weltkrieg, gab es keine Herausforderung an unser Land mehr, bei der es so sehr auf unser gemeinsames, solidarisches Handeln ankommt.
Germany has introduced sweeping confinement measures like its European neighbours, such as increasing border restrictions and shutting schools and other public spaces. But it has stopped short of forbidding people to leave their homes. But young people have been accused of having a cavalier attitude to the threat.
Schwere Frage. Also klar ist es mau, wenn sich so viele Leute treffen, aber ich weiß nicht, es ist voll schönes Wetter. Das war ein übelst doofer Winter so und jetzt kann man halt mal wieder rausgehen. Das ist halt natürlich unter den Umständen ein bisschen zwiespalten.
Ja, wahrscheinlich wird es uns auf die Füße fallen, weil wahrscheinlich wird es dann als Regel erlassen, dass wir das nicht mehr dürfen. Und das ist dann schon auch der Moment, vor dem ich Angst habe. Aber ich glaube, wir sind als Gesellschaft nicht fähig, einfach selber jetzt vor allen Dingen mit dem Wetter uns selbst da zu maßregeln.
Europe's largest economy is the fifth worst hit by the coronavirus globally. The US-based Johns Hopkins University is reporting over 12,300 confirmed cases as of Wednesday evening and 28 deaths. Chancellor Merkel says these are not abstract statistics, but people's mothers, fathers, grandparents and partners, and that every life, every human being counts.
In the US, financial aid is now being offered to anyone who falls ill from this new virus, with free testing for those who need, and paid sick leave and family leave is set to be provided for. President Donald Trump signed a $100 billion emergency aid package specifically for that, with more federal assistance set to be in the pipeline. On the wider economic front, however, financial markets are in rapidly deteriorating health. Fear, uncertainty leading to heavy losses. Wall Street ending down across all the main indexes. And meanwhile, on the Asian markets, well, we're seeing more of the same with heavy losses so far in trading. You can see there the Kospi and so down well over 8 percentage points. The Hang Seng in Hong Kong down almost 4%, but all of them solidly into negative territory. Well, in keeping with our bid to reduce the number of people outside of their homes during this crisis, we're going to cross now live to a Parisian apartment where our journalist Cole Stangler is working for us today. Cole, firstly, tell us more about the US aid packages. There seems to be a few different ones on the table.
Right, so this plan that President Trump has just signed is really directed at providing relief for workers. So as you mentioned, this is focused on providing paid sick leave, on expanding unemployment assistance to the states, which then disperse the aid. It's going to provide free testing. There has been some criticism of this plan for not going far enough. You know, large companies that have over 500 employees are actually exempt from this requirement to provide paid sick leave. So there has been some pushback on that front. But the idea is that this will provide some relief to really working people in the United States. And as you mentioned, this is really one piece. There's a second major plan that's being rolled out right now that's being addressed, written in Congress. And this one is a $1 trillion package. So actually bigger than anything we saw in the financial crisis of 2008 and the plans that came out of that. So a $1 trillion plan. Half of that, $500 billion, is made up at providing direct aid to American taxpayers. So essentially writing Americans checks that they could then go and use and stimulate the economy. The other piece of that will be directed at businesses. And that second piece, there's a lot of debate right now about what kind of form that will take. You know, that there was a lot of pushback, again, from the financial crisis and the bailouts of Wall Street in 2008, 2009. And so the question now is what kind of aid will be given.
Meanwhile, Cole, here in Europe, the European Central Bank, the ECB, also putting some 750 billion euros on the table in response to this COVID crisis.
Right, it's called the Pandemic Emergency Purchase Program, and this is really designed to provide a strong response after the ECB came under criticism for not doing enough to promote stability in the European markets, especially when compared to the Federal Reserve in the United States. The idea here is that the central bank will be buying up both private sector debt and public sector debt in a bid to show that it's ready to support European governments that have been hit by this coronavirus. Countries like Italy and Spain, where we've seen in recent days the cost of borrowing spike dramatically, the ECB is essentially saying it's going to support those governments. And so the idea is this sent a strong message to investors.
Okay, Cole, for now, thanks indeed. Cole Stangler there, coming to us live from the other side of Paris. As here at France 24, we heed that call and we are trying to keep as many people at home as possible. Well, that's where we're going to have to leave it for this edition. Do take care.